Dr. Jihad Abouali, thank you so much for joining us tonight. Super excited to have you as part of our interview spotlight. And you're a proud partner network, and we have a ton of trust and confidence in you. And so we're trying to reach out to people within our local network as well as kind of regional network that we think are important and have some important things to share, and we have a lot of confidence in. So you were kind enough to jump into that series for us. So thank you so much for jumping in tonight.
Great. Yeah. Thanks for having me.
Yeah, no worries. So I know your time is very valuable and I don't want to keep you too long here, but I had sent you some questions ahead of time, and just to give you an opportunity to prep and maybe ponder on some of these deep thoughts that we're asking. But ultimately, as I just mentioned, with our network, we've really kind of fostered people that we have a ton of confidence in. And I'm sure because you work at a few different places throughout Toronto, you must have the same. So my question is, what is important for you as part of, you developing trust in a practitioner or a referral source? And then how do you continue to maintain those networks as you are so busy through your schedule?
Yeah, it's a great question. So a part of my practice will be obviously very surgical, and then I'll often refer patients out for a therapy to see a practitioner to kind of rehabilitate afterwards. And it's very important that I listen to the patient's experience about the kind of care they're receiving. So I don't just send them off for physio or athletic therapy and on their way. I will see them and follow up and ask how they're doing, how they're progressing, and what kind of care they're doing with their therapist. So it's important I get that feedback from my patients to see, what kind of hands-on care they're receiving. So that's probably the most important thing. And then once I've heard of good things around the community or about good clinics, I try and make a point of reaching out and meeting them, or at least talking to them to see that we can establish a one-on-one connection, much like I made with your clinic, and that way it becomes a bit more personal. We feel confident that we can be open and talk to each other about challenging issues or just how to maximize our patient care. So I think establishing that personal connection with different therapists and clinics around town has been important.
Yeah, it's so good. And there's so many great ones, especially you're downtown. You've got many options to choose from, right? But once you get a few of the good ones, you really want to hang on to them as far as, keeping them apprised to what your requirements might be. And I think that's, we do the same. When we find a good referral that we have trust in, we want to make sure that we try and keep as friendly as we can with them as well, right? And so with our experience, I mean, that's been one of the great things, having a relationship with you is we really believe in your honesty and trust your opinion, obviously. And a great example of that is I'd sent you a patient a few years ago. I thought for sure she was going to be a surgical candidate. She was subluxing chronically, came to me. I assessed her right away and I thought, okay, like she's going to need some help. And you were kind enough to see her, and very quickly you said to her, you just need to get stronger and do some great rehab. And so she came back to us and reported that to us, like, it's so great to hear, because she needed that feedback, and it wasn't at all what she was looking for. Right. And so it's really great that we were able to provide that confidence in her ability to get stronger, and your confidence in our ability to lead her, which was really good. So one of the biggest things that she was impressed about was you're in the surgical industry, that's your business, but you wanted to defer it or not do it if you're at all capable, right? So I'm curious as to like where you came up with that philosophy, and maybe some of your mentors that you're following to create such a positive patient experience for people who come into your office.
Yeah, I think like you said, my role as a surgeon is to determine who truly are the best candidates for surgery and who doesn't need surgery, and maybe like you said, we can delay it, or maybe they don't need it at all. So it can be tough decisions at times, but I think in my training and my practice, I've always tried to keep it patient-centered, my approach to treating patients. And, that was kind of ingrained in my medical school training at McMaster. That was a big part of their philosophy, is to really center decision-making around the patient. which was kind of a going against the grain a little bit, the way medicine used to be taught, which was very paternalistic. Doctor knows best. Here's what you need to do. Take it or leave it. Right. Yeah. Now it's more about understanding the patient, their goals, what they've tried and what they need to do. And so I think early on from my medical training, that has really been an important principle of mine. And so that particular patient you're talking about, I just felt that they hadn't given it enough effort with their rehabilitation. And I could see that there was some imbalance and weakness that would far do better with non-surgical approach than it would have done with surgery. And sometimes surgery, even though it's invasive, it can be the easy way out, but it's not necessarily going to be successful. It sounds like, okay, let me just cut you open and I'll fix everything, but that's certainly not the case a lot of the times. It has to just be more of a true rehabilitation approach.
Yeah, which is amazing. So it's great that, I mean, I'm in the rehab industry, and so that's my bread and butter. And if we can be a little less invasive and have the same results, and then I mean, job done, and kudos to you for kind of having that philosophy.
Right.
So I mean, you've been in the industry for a while now, and you must have seen some pretty, and you work, I think, in the ER too, right? Aren't you on call sometimes for ER?
Yeah, so I do trauma work, so mostly broken bones, fractures, dislocations, things like that.
Yeah. So with that, what are some of the great, well, it's not great, but what are some of the most radical things that you've done, and maybe some, if you can just share a story of something that you're really proud on or proud of, where you had a great result? Because I'm sure not all the stories are good, but there's got to be a few that you're really impressed that you thought was a great outcome.
Yeah. So, trauma and orthopedics can range from very severe musculoskeletal injuries and fractures to sort of more sports related emergencies where you can get sort of soft tissue injury or cartilage injury, but it still needs to be identified and treated on a more urgent basis. So I have two examples that really stick out in my career. The first is a bit more of a sad story, but it happened when there was a shooting on the Danforth, and my hospital was close to just off the Danforth. And unfortunately, that was, I think, a couple of years ago now. And one of the patients that came in had a gunshot wound, and the bullet had created a fracture. And so we don't see a ton of that high level, gunshot wounds and trauma at my hospital, but because of the proximity of where this happened, I was called upon, I was on call that evening and had to take care of, a very traumatizing situation for the patient, more than usual, because it was sort of, almost a violent act that we don't see a lot of in Toronto. So I did feel very privileged to be able to help in that situation, not just because it was so traumatic, but because, the patient really needed orthopedic care, and I was able to provide it close to home, close to where I work, and close to where I live, frankly. So I felt, it was an honor to be able to take care of my community in a troubling situation. So that'll always stick out for me throughout my career. Yeah. And then sort of more on a sports related trauma, I have another patient that quite young, teenager, was involved in just sort of a bad basketball injury, had fractured a piece of cartilage off of his knee. And I wouldn't say it was misdiagnosed by the emergency doctors, but it was kind of treated as, let's just rest it and see what happens. But they sought my care just because of my surgical and sports background. Yeah. And with a little bit more investigation, we realized he actually had a bad fracture of the cartilage out of his knee, and he was a scholarship hopeful athlete. And so it was really important for him to get back as soon as possible and in good shape. And so we brought him in on an emergency basis to fix and repair that cartilage damage in his knee. And it did take a while to heal, like they all do, but I think because we caught it early, the result was quite good. And he went on to, have a university scholarship, and,
Amazing.
he's still playing right now, varsity basketball. So those stories where, I'm not only impacting their sporting lives, but perhaps their educational or social lives really sticks out, and something I'm proud of.
Amazing. And when we work with athletes too, they're always so goal driven, and whether it's from your end, from an orthopedic perspective, or our end from a rehab perspective, to help them achieve their goals and be part of their success is always like a small victory for us, and at our clinic anyways. And so it's always a good way to celebrate, for sure.
Absolutely. Yeah, definitely.
So then that moves us into some of the other exciting, obviously you're a surgeon, it's part of your industry, but you're into some regenerative medicine as well, right? With PRP, stem cell. And so, I mean, we've been in the game for 15 years, and that wasn't around 15 years ago. And then around 10 years ago, we started to see it almost just mentioned in passing, like it was coming. And now it's becoming a little more available, which is amazing. And I know that you do both at your clinic. And so you've had some success with that, obviously. And so I almost look at you as being relatively cutting edge as far as using your skills to not just do surgery, but also to incorporate some other kind of newer medicines. Do you think there's anything else coming down the line that would be comparable to PRP or stem cell?
Yeah, there are certain things coming down the line that are within the realm of what we call orthobiologics. So that term is essentially using one's own biological potential to enhance healing within the body for injuries or chronic disease. Yeah. And so PRP has been the gold standard for many years now, for treating like mild cases of osteoarthritis or mild tendinopathies of the knee or shoulder, with some pretty high success. Stem cells is still being evaluated and kind of modified to really find out the most successful way, not only to apply it, but to sort of, develop it, how to purify it and concentrate it in the best way. And there's a lot of other growth factors and proteins found within the blood that, again, same thing, we're just trying to develop and find the most suitable way to use it in orthopedics. Yeah. When you talk to someone about PRP or stem cells, there's so many different ways to create it or to process it, to spin it. And we haven't really found the perfect technique for each sort of disease or pathology. So I think that really is the next wave of orthobiologics, is trying to find disease-specific approaches for each type of injection.
Amazing. And it really has evolved. I mean, we talked about stem cells 10, 15 years ago. It was umbilical cord blood, and now we're able to harvest it through a couple different ways from a biological perspective, right? Which is, I mean, I think it's amazing, and hopefully we're able to continue to advance that down the road for the benefit of the patient.
Yeah, we've used stem cells in orthopedics for a very long time. So it sounds brand new, but from a surgical perspective, we've used bone marrow and blood tissue for all kinds of applications within surgery for a very long time. But now we're just trying to take it out of the operating suite and use it in more of a clinical setting, so we can avoid major interventions if we can. And that's where we're really trying to focus and narrow the indications down to see when we can truly use it in a clinical setting.
Yeah, amazing. I think it's great. Hopefully we continue to just become more efficient at it and have greater results with it, right?
Absolutely.
Yeah. So again, I don't want to take up too much of your time, and I'll let you get back to your nightly routine with the family. So at our clinic, one of our slogans, we have a couple, but one of the ones that we just kind of catch ourselves saying very often is "motion is lotion," and it's almost words to live by. People who are sedentary, you need to get them going. People who are post-op, you need to move the joint. People that are stressed, like you need to go for a walk, you need to get moving and help deal with that. So it can be applied on many different levels. In your clinical practice, do you have kind of a slogan or words to live by, something that you try and impart throughout a daily practice and mantras?
Yeah, when you wrote me that question, I was trying to think of, is there anything that I always say to patients? And I don't think I have any catchphrases, but
Yeah.
patients will often ask me, oh, if I was one of your pro athletes, what would you do?
Yeah.
Because I've worked with some professional teams like the Toronto Argos and
Yep.
TFC, and I tell them I'm giving you the same treatment I would give my pro athletes. Like,
Yeah.
it's the same thing, I'm giving you professional athlete care for the athlete in you, so to speak, right?
Yeah.
So I don't change my approach depending on, oh, someone's a superstar, we're going to give them the best treatment,
Yeah.
and you just like to play soccer on the weekends like myself, so we're going to give you the B treatment.
Yeah.
Everyone gets presented the same treatment,
Yeah.
at least the options. And then, like I said before, it's very patient centered. What are your goals? What is, what risks or, efforts are you willing to make? What have you already tried? And we work within that to see, how we can get you in the best possible shape. But
Yeah.
there's no, oh, I'm only saving the good stuff for the professional athletes. Everyone
Yeah.
has the same approach, same options, and we work with what you can have.
Yeah, it's great because I'm smiling so big over here because this is part of what we present as far as our treatment plan goes is, okay, so best case scenario, this is what you would do to help yourself get better faster. And you can hear them kind of waffling. I don't know if this is for me. It was like, well, if you were a professional athlete, you'd be in the same kind of routine and the same amount. Your interests might be a little bit different. You may not be starting in the hockey game tonight or on the basketball court tomorrow morning, but you might be trying to get back to your life and going for a walk with your kids or out gardening or whatever it might be, right? So yeah, it's great for us to hear that that's part of it as well. There's no magic wand one way or the other. This is the pro athlete wand and this is the regular Joe wand. It's ultimately the principles stay the same, right?
Yeah, my practice is so diverse, right? Like I said, I have some professional athletes, I have varsity athletes, but I also have grandparents who just want to play with their grandkids, right? And they have shoulder pain or knee pain. And so my goal is to get you back to living a healthy, active lifestyle with whatever means that I can help you with, whether it's surgery, injections, or referring on to great therapists like yourself.
Yeah, thank you. We're doing our best here, and that's all we can do, right? So amazing. Well, once again, I wanted to thank you so much for one, being part of our network, two, for spending a few minutes with us tonight. And I already indicated to you that we're going to pop this on YouTube. It's going to make it available to our clients, and it'll be great too if we're fortunate enough to continue to have their relationship and refer to you. We can lead them to this webinar just to get them familiarized with you and some of your philosophies, and so hopefully we see some benefit from that. So once again, thank you very, very much. Appreciate it. And yeah, I'll let you get back to the routine. Okay.
Okay, my pleasure. Thanks for having me.
Oh, if anybody is looking for Dr. Abouali, you treat at a few different spots throughout Toronto. You're at you're at Michael Garron Hospital, right?
Garron Hospital is sort of my main location, and then I work out of the beach. There's a clinic there and a clinic downtown, so I try and be a bit more accessible that way. But my main practice is at Michael Garron Hospital, where I do my surgeries out of.
Amazing. Okay, I'll make sure I include all of your social media handles and your website just in the notes here, and yeah, look forward to working with you and seeing you again in the future. Okay.
Yeah, thanks so much, John.
All right, take care.
Yeah, you too. Bye now.
Bye-bye.